my name's Hannah. I'm going to be a student nurse today. So this is soap, not hand sanitizer, but we're pretending it's hand sanitizer. So this is my hand hygiene, washing my hands. Can you tell me your name and date of birth? Awesome. Do you have any allergies? And are you in pain today on a scale of 0 to 10, 10 being the worst? Okay, cool. Today we're going to be inserting a Foley catheter. It'll take about 10 minutes. Your perineum will be exposed and I'll have to touch the area. Is that okay with you? Okay, awesome. So I'm going to raise the bed and I'm going to lower the side rail on the side that I'm working on. I'm going to wash my hands again. Hand hygiene, put on a pair of clean gloves. All right, so have my clean gloves on. I'm going to position the patient, bend the knees, have the knees fall out to the side. All right, now I'm going to take these off. And I'm going to throw out my trash can that is right here. I'm going to wash my hands again. Hand hygiene. I'm going to take my cling out of the bag. Throw this away in my trash can. Okay, so I'm going to open this up. First, away from me. Side and side, keeping only within the 1-inch border. And lastly towards me. Okay, touching only the 1-inch border on the outside of it, I am going to scoot it back. Okay, I'm going to take the sterile gloves, so I can touch that, put that over here. And now I'm going to take the drape with only the 1-inch border. And I'm going to lay it shiny side down in front of the patient. One-inch border to flatten it out in front of the patient, between their legs. Okay. I do not need this, so I can throw that away. Okay. I am going to put on my sterile gloves. So to do this, my sterile gloves actually ripped. I would bring a bigger size sterile glove in real life, but I'm going to open my sterile gloves. I am sterile, so I can fix my finger. Okay, awesome. So I am sterile. I'm going to grab the inside of this, and I'm going to throw it away. This, I can scoot back closer to me now. Now I'm going to position this within the 1-inch border. The iodine, I'm going to put onto my cotton balls. Do not need that anymore. The specimen container, I do not need this, so I'm going to get rid of it. I have some lube. I'm going to put a little bit right here. Awesome. I can get rid of this now. I'm going to move this guy over here within the 1-inch border. I'm going to take the blue covering off of my catheter. Get rid of that. I'm going to put some lube on the top 1 to 2 inches of the catheter and replace it back into the box. My water, take the cap off, get rid of it, and I'm going to attach it there. Put that in the box. I'm going to stack it all back together, and I'm going to move the whole box over to the sterile field between the patient's legs. Okay, so I am going to spread the labia. I am going to clean from the top down, discard in my trash can. From the top down on the other side, discard in the trash can, and then last time, from the top down, down the middle. Discard, get rid of this, I don't need it anymore. This whole thing is gone, I don't need that anymore. All right, so now I'm going to tell the patient bear down. 1, 2, 3. Insert the catheter. I see urine, so I'm going to go in 1 to 2 more inches. Okay, and I no longer have to be sterile, so I can pinch off the tube to hold it in place. I'm going to push in the 10 milliliters of sterile water. Okay, I'm going to unscrew this. I no longer need this, so I'm going to get rid of that. Give a little pull to make sure that it's in. Awesome. I'm going to take this, no longer need that. The colorful pieces are taped to the inside of the patient's leg with enough room so that they are not uncomfortable and pulling on the catheter when they move. The bag is hung below the bladder on the non-movable part of the bed. Okay, so it's hung down there. I'm going to ask the patient if they have any questions. I'm going to clean them up, take off my gloves, perform hand hygiene, and then that's it. And now I have orders to remove it, so I put on a new pair of clean gloves. So new pair of clean gloves. This is not a sterile procedure. I don't need to be sterile for this. I already emptied out the bag, unhooked it, untaped it from their leg, so I have this up here. This is all new equipment. I'm going to tell the patient, I'm going to be removing your catheter today. Do you have any questions? Your perineum will be exposed and I'll have to touch the area. Is that okay with you? Awesome. All right, so I am first going to take my clean syringe, attach it, and I'm going to withdraw the 10 milliliters of sterile water that I just put in there. And I'm seeing air bubbles, so I'm going to keep the syringe pulled up to unscrew. Don't need that anymore. Now I'm going to tell the patient, on the count of 3, take a deep breath out, and I'm going to pull the catheter out. Ready? 1, 2, 3, out. Awesome. Wrap it up in my glove, pull that around, and we are going to discard of everything as my facility guidelines say I should. That is all done. I'm going to wash my hands. I'm going to lower the bed, put the side rail back up, ask them, is there anything else I can do for you? Give them the call light. Thank you. Have a good day. Hand hygiene. We're done.